Hi, everyone. I'm Dr. Natasha Iyer, and this is Dr. Shabnam Daskar, our Director of Medical Education at Live Younger. In the quest for living younger, it's beyond vanity. It's about functioning well. And we talk about health span and lifespan, right? And so lifespan is how long you live, your health span is how well you live. And what we want is your health span and your lifespan to match, not have a health span and then a lifespan where there's this big gap of disability. We also have circumstances like some women age better than others, right? And Halle Berry has always been when somebody says, who do you think is the most beautiful woman in the world? I'd go Halle Berry. And I just love her personality and how graceful she is. And what I love is that she always looks natural and normal. So
Yeah.
when we say she's aging gracefully, but the video that you sent me was alarming because I could see the sudden dramatic aging in her appearance. So, Dr. Carr not only researches the literature and keeps us up to date with the latest and the best information for all of our protocols and programs, she's also my resident media expert because
Not
I
really.
wouldn't have known that Halle Berry appeared and has petitioned Capitol Hill in the US to pass a bill on menopause and women's health. And so, thanks, Dr. Carr, because I guess I'm just under a mushroom somewhere and you keep track of everything, not just in the medical journals and latest publications. So, a couple of things about that. When you sent it to me, I was like, oh my word. First of all, she was misdiagnosed that she was in the menopause.
Hmm.
And yes, it always takes movie stars to bring up this conversation and take it so much further, right? Like Suzanne Summers.
Yeah.
Otherwise, there's no conversation. I mean, she came out and said that her gynecologist misdiagnosed her as having herpes, which you and I were talking about how odd that might be. But nevertheless, she had not even been considered to have hormonal issues causing her symptoms. They had to give her a different diagnosis. And that's what you've been going on about for the last multiple months, right? About perimenopause and women not being diagnosed. Now, when you started that, what was the biggest key thing that you feel women are being disadvantaged by not being looked at for their hormones?
So anyway, a little bit of background, Natasha. What you're talking about, Halle Berry and her, address to so many people at the Capitol Hill, and that video is available. Anyone can. And what I really liked is there were a lot of older women in the background, so they could all relate to that. She's 57 now, I think. So what she said is she was caught unawares about the menopausal transition and perimenopause. So for most of you listening, you probably know what is perimenopause. Menopause is when you haven't had a cycle for 12 months, and it's a permanent cessation of cycles. So it's an end of reproductive period, and it's not because of any other medical condition. So the 8 to 10 years before menopause is perimenopause. And most women, including Halle Berry, were caught like suddenly, like, what's going on with me? Because they are not expecting to go through any kind of symptoms in that period. Now, the fact is, and this is a problem, Natasha, you have a lot of patients who are otherwise super healthy. Like they are physically active, they look wonderful and beautiful,
And they're
and
suffering on the inside. Their
yes,
sleep
it's
is being impaired, their thinking is being impaired, their brain function, they're like, my brain's not working. I think I'm getting dementia. I
yeah.
can't sleep worth a damn. I'm tired, but my tests are all normal. And that, I think, is what got your knickers in a knot, right? You were saying to me, um, women are being so disadvantaged, and that's why we did the video on the perimenopause and how the hormones are all over the place and causing absolute chaos and havoc. But doctors don't have this one knowledge or training or information, or it's just not on the radar because perimenopause was never considered something worth looking at and treating. And in fact, most of the patients that come to me get thrown on the birth control pill because of the irregular bleeding, but there's no attention to all of these other life altering, life robbing symptoms that they're having, right? And so with Halle Berry now, I am so glad we can have this conversation. And the most important thing I wanted to talk about today is about how women try to find solutions on their own. And
Mm.
as she comes out publicly and says women were lost, like they just weren't
Yeah.
looked at all. But then the women that have been trying have not always been finding the right solution. And what I wanted to cover today in particular, other than just hormones, which we talk about a lot, is what are the steps before hormone balancing? And it came up because you sent me the video, and my new patient yesterday, she just said, why aren't more women having this conversation? Why isn't it out there? And she suspected she had hormone issues, but she went to a specialty hormone clinic, got hormones. No, sorry. First, she went to a family doctor who gave her hormones, which is great because at least he was open.
Mm.
And
Yeah.
then she broke out in the most hideous acne. She says, my face was all one big acne in my lower face and neck, right? And she said it wasn't even like separate things. It was just all one big acne. So she stopped the hormones and it went away. And her doctor said, I don't know what to do about that. So I
Mm.
guess you're just not going to get them. And you and I both know progesterone is, I mean, not more important. They're both critical, estrogen and
Yeah.
progesterone. But in my life,
Yes.
I cannot live without my progesterone, right? And that's the thing. It's a neurosteroid. It helps the brain. It helps you sleep. And then secondarily, or on the same level, it's helping bone strength and so many other benefits, right? But she failed a hormone trial, then went to a specialty menopause clinic, a bioidentical hormone clinic. And the exact same thing happened to her with bioidentical hormones as pharmaceutical hormones. So then she says to me, hormones are not for me, but my daughter has had such great success with you. Her acne is all cleared up. And I trust that you'll be able to help me get hormone balance because I want my life back. She
Yeah.
cannot get a deep restorative sleep. It affects her life, her functioning, her enjoyment of life. These are all important things. And how many of us in our 50s are active in the workplace and actually moving on to bigger and better things, not trying to shrivel up and die as the body shrivels up and falls out, because of hormone decline. And so, I said to her, I said, I am very particular about hormone balancing, and I would never give you hormones the day you walked in or the
Mm.
first week that you walked in. And from her reaction, it's very obvious that one, her metabolism of progesterone is going down the pathway toward androgens, testosterones and androgen, but there are multiple other androgens that can, and yes, acne down here is mostly hormonal and androgen based. So yes, she's given progesterone, it metabolizes and it becomes androgenic. So what we would have to do is look at the pathway. But if we go back and we look at her history, she's had antibiotics. She's had some, like she's got horrible digestive symptoms. If your gut's not working well, you cannot balance hormones, right, Dr. Carr?
Absolutely.
Why
So
do you need a healthy gut?
So this is how hormone therapy, standard hormone therapy versus what is done in functional medicine differs. But Natasha, I'm like something is niggling at me. I better get it out. We talked about the age of menopause is in the Western world, it's an average of 51 years. But then not everyone goes through menopause at 51. There are younger women, and for them, it's a bigger shock. So women can go through menopause even after a hysterectomy, even a natural menopause in women in South Asian countries, its average age is 46.
Hmm.
So my point is this is exactly what we were discussing. If you are in that age group and you're going through all these brain fog, difficulty sleeping, mood issues, anxiety, gut issues,
Irritability.
irritability, and we talked about that in the other video. I don't feel like myself is what patients have been saying. Patients come and tell you, I think
And
I'm
and
going
it
to.
and I'm seeing it now in women in their 30s,
Yeah.
Dr. And that's the thing. So it doesn't matter your age, you can be
Mm.
perimenopausal or most commonly, it's progesterone that's declining in your 30s,
Yeah.
and you need to pay attention to this. But as far as the gut, can you just tell us why the
Yeah.
gut is crucial for hormone balancing, please?
So, most importantly, estrogen is metabolized through the gut. And if the gut is not healthy, what ends up happening is we have these wonderful gut bacteria which actually help in metabolizing estrogen. So, if you are someone who has constipation, for example, then what happens
Who
is
doesn't? Everyone walks in and goes, "Oh, I'm supposed to poop every day?" Yes, 2 to 3 times a day. And now I tie in that it's critical for hormone balance. So they take me seriously, because in the past I would just say, this is the goal, we have to do this. And in my head, for your hormones to be healthy. But now I speak it out loud. I go, if you want healthy hormones, if you want to reduce your risk for breast cancer, if you want to keep your breast, and for men, prostate health, you have to have good bowel movements, because your gut function tells us how efficiently you're going to look after hormones. So your liver function, your liver enzyme pathways are critical, and knowing whether they're working efficiently or not. And sometimes they can get backed up. So that's why we look at toxins and xenoestrogens and endocrine disrupting chemicals. And I insist that patients reduce and remove all of that and go through a process to eliminate them from the body before we start hormones, because we want the liver pathways open and clear and functioning well. And then, as you said, we want you to be pooping 2 to 3 times a day, so that when we give you estrogen and it's metabolized, the metabolites will be pooped out, and those healthy gut bacteria do not allow the recirculation of the thing. And then there's a process called glucuronidation and all of these things that we will not go into, but that's what you need from the bacteria. The bacteria in your gut are critical to help you get rid of estrogen metabolites. So for me, when she says she has acne, when I do my skincare, and we have a skin science center here, which we were just talking about earlier, and I tell patients, your skin is contiguous with your gut. So whatever you're seeing on your skin is talking to me about what's happening in your gut. So sure, the progesterone might be metabolizing into androgens, but do we have any other gut issues? And she has symptoms. Show me a patient who walks in here without symptoms of gut dysfunction, right? IBS, bloating, constipation, diarrhea, food intolerance, whatever. And so with this process, I said to no, we've got to work on your microbiome. We have to heal your leaky gut. We have to make sure that everything's working well. Open up the liver enzyme pathways. Would you like to pull up your lovely steroidogenic pathway so that we can just see what I'm talking about here?
So, can you see my screen?
Yes. So with her, most likely her progesterone is going into androstenedione, which then can go down into estrone, yes, which is not an estrogen we want, but that's for a different talk for a different day. But you can see that androstenedione can become testosterone. So she might have activation of those pathways going straight from progesterone to testosterone, and then trying to go down the estrogen pathway, instead of progesterone going down to aldosterone and the corticosterone pathway, which is most commonly what we would see, right? So on the left-hand side of that pathway. In my office, I have this, and this is what I love to use because it actually, and yours does too, I just can't read it as well, but we have the liver, so the liver pathways that are genetically modulated. So your genes determine how these pathways work, as well as all these toxins and dietary things like inflammation, alcohol. You and I talked about alcohol and hormone balance at great length. So watch that video if you're interested. But with this patient, it's not that she can't take hormones, because her body naturally made progesterone in the past. So then what's different now? We're giving her a bioidentical, so it's the same as what her body made. So then it can't be the progesterone, it's how are we metabolizing it when we put it in. So a couple options: open up the liver, fix the gut, get the metabolism well, get the pathways cleaned out, get all the toxins out. And then another option is to not use progesterone. We could use pregnenolone and watch how her body breaks it down into other things and hope that she can make some progesterone that's more natural to her body, then she won't react. So you had a comment about that thought.
Yeah, so first of all, very important things you brought up, and I would like to revisit the liver pathways later. But what you brought up is giving her pregnenolone, and this is where, the advanced knowledge. And Natasha, you've been practicing hormone therapy for how many years now?
18 year, just over
18, yeah.
18 years.
So this is where the clinical experience meaning seeing patients day to day. And so I must also actually praise your patient, because that she's willing to, go through all this
But
and
she's
know.
desperate.
Yeah.
She wants to sleep. And her research has led her, which is interesting because not a lot of people find that in their research.
No, not so
In fact,
easily.
I told you about a friend of mine who actually went to a gynecologist who said I was not on the right track by saying she
Yeah.
needed progesterone, right? But a patient managed to do the research and find out that progesterone is a neurosteroid, and
Yeah.
she knows that it's the perimenopause, menopause that wrecked her sleep. Prior to that, she slept really well. When her hormones changed, she's not sleeping, and she wants her brain back. She wants her sleep back. She wants her metabolism back. She knows she can't burn fat. She says, my chest and my abdomen are all one. I can't distinguish them from each other. So I would like to, at the end of this process, get rid of this, and she pats her belly so that you can see I have a chest and an abdomen, not just one thing. And so, you can't burn fat without sleep, but you can't burn fat without good hormone balance.
Also, yeah.
So there you go. And her research says I need progesterone. And so she decided to give it a try with someone who has, clinical results with a lot of people she knows,
Mhm.
her daughter included. She noticed that, my patients range in age from their 30s all the way to their 70s. And
Oh no, you have older patients,
I
Natasha.
do too. I do too.
80
But they've been with me for a long time. I
Yeah,
don't usually get an 80-year-old coming in as
for
a
the
new
first
patient.
time
I've
now.
had two in the last year or so, but it's not usual. But yeah, anyways, we decided that we would do this in a very step-by-step fashion. And I said to her, I said, we will not attempt hormone balancing until the basics are done.
So, what I want to highlight here, because many people listening may not know the intricacies of hormone therapy in that sense, and this includes doctors as well. I'm a former OBGY. I had not studied anything much about, don't remember studying anything about the perimenopause or, the right kind of
I did
hormone.
a residency in
Yeah.
gynae. I worked in a menopause clinic. We did not do that either.
So what you are saying is, number one, we do, when people like Halle Berry and all these celebrities start talking about it, I do hope there's a lot more research being done, because the fact is there is no one simple test to test for perimenopause. And I have patients, Natasha, who will come and tell me, I got my tests done. This is my patients in India. My
And it's
hormones are
normal.
normal. I said, you got it done one day of the week. What is happening the rest of the week, we don't know.
It
And
can
more
even change
important,
within the same day because
yeah.
when my progesterone, I can become a psychopathic, enraged person when my progesterone was going up and down like that. And honestly, my children would even say, like, do you need to go to a psych hospital? Like, how can you be happy 1 minute and then so crazy the next minute? And I'm like, I don't know. And they're like, aren't you the hormone doctor? Yeah, but my body is playing against me right now because I'm trying to do this and then it's doing that. And so the perimenopause is very difficult to manage, but we tend to be successful when we follow the steps. When
Mhm.
we get the gut and the liver working, yes, your body's working against you, but we can, and that's the other reason I prefer progesterone that's compounded and pills. One, we can change the dose. So
Hmm.
I can give you 10 milligram pills if you want, and we
Yeah.
can play around with the dose and change it per day. So you had a terrible sleep tonight. We'll try a little extra tomorrow without overdosing you.
Yeah. That
As
that is
opposed to a
critical.
pharmaceutical where it comes as 100 milligrams. That's
Yeah.
it. You can take 100 or 200 or 300, but nothing in between. I have a patient 54 years old. She's on 75 milligrams and her blood levels are sky high. And she's getting belly fat because we know progesterone can increase belly fat, and that's for a different day. And so I had to lower her dose.
Mm.
So there's no age dose. It's like what we are so frustrated with in medicine, where it's a one size fits all. Take this pill, take that pill, the dose is the same. Who cares? Everybody gets the same dose. And yet here's a woman in her 50s needing teeny tiny doses of progesterone for whatever reason that's unique to her. And we're all bio individuals. I mean, you and I are on very high dosing of progesterone, but I think in the whole practice, we might be the only two, we're so special, at that high dosing, right? It's very rare that we dose high in progesterone when everything's working well. Now I say that, and I'm wondering if it's genetics or racial or
Yeah, so this is where today we don't have the information, but hopefully we will have soon. I'm just going to pull up that,
pathway again.
diagram again, because what I want to highlight is why we're talking about the liver. So Dr. Iyer mentioned about the liver pathways. Now you can see all these hormone conversion of androstenedione to testosterone to estrone E1, which is the one that is related to higher risk for breast cancer. And we've talked about these elsewhere. You can see, I know you can't see very well, there's a gray arrow and there is the name of an enzyme here. So it's not just one enzyme. There, how someone metabolizes estrogens, whether they're making healthy metabolites, they're making the harmful ones which raise in risk for breast cancer and all the bad stuff. That is regulated by enzymes, and enzymes are coded by genes. And genes can have minor variations. We call them SNPs, so single nucleotide polymorphisms, which can make them more efficient or less efficient. So that is the first complexity. The next complexity, I know you can't read, I can't read them either. These green boxes have a whole lot of other factors that can influence how this particular enzyme pathway works. Now, today, we are not at that position of personalized medicine where we can do a few bunch of tests and tell you, this is exactly the problem for you, and we are just going to do this, and this is going to happen. No, we hopefully will reach there someday. But my point is, this is way more complex than just increasing someone's hormone dosage because a particular symptom is like, oh, your hot flashes have not gone away, so let me just increase estrogen. And Natasha, how you talk about, okay, this didn't work, just take some antidepressants.
That's what we used to do in the menopause
Yeah.
clinic. Point 3 doesn't work, 0.625 doesn't work, 0.9 doesn't work of Premarin, no problem. It doesn't work at all. Off you go. Here's your antidepressant and some clonidine, and off you go. That's it. And today we know that bio-individuality is what's so crucial to hormone balance. But we're not talking about hormone balancing. We were talking about why people sometimes get side effects, why they think they cannot have it, and why we in our clinic are so particular about gut health and liver health and supporting the detox pathways before we ever step into hormone replacement therapy using bioidentical hormones. So thank you, Halle Berry. And thank you, Dr. Carr, for educating me that Halle Berry is on the menopause bandwagon and to educate women. And now here we are helping you stay educated too. Thank you for your attention. And by all means, join us on our newsletter. You can sign up on our website, liveyounger.ca. You can also contact us through liveyounger.ca and book a consultation with either of us to talk about your hormones, or you can join one of our programs. So Dr. Carr will do a consultation with you. I do full programs with you. She can do programs with you too. I believe you must commit to multiple visits. She'll have the introductory consultation with you and guide you. And then together you'll get a comprehensive program with both of us to balance your hormones and look at all of these details. So we look forward to working with you and helping you get your life back.
Thank you. And bye now.